Swedish Health Services is located in the Pacific Northwest in Seattle, Washington. We've been in existence for over 100 years here in the community. Swedish TeleHealth Services really try to focus on being able to leverage technology to bring care to the local communities. Many patients aren't able to make the journey into the city, or they don't have the specialty care available in their local communities. So with the use of telehealth and telemedicine programs, we're able to bring these services to their local communities and to deliver care that they wouldn't otherwise have access to. Swedish has its roots in telehealth dating back to 2004 at the inception of our tele-ICU program. Moving beyond tele-ICU, we developed telestroke to be able to treat acute stroke patients. And beyond telestroke, we've expanded that service into numerous telehealth programs to now have over 30 different programs within our telehealth department. All of these programs utilize the telepresenter role to facilitate the physician exam as well as using peripheral devices. The role of the telepresenter is really important. At the remote setting, they can be the physician hands extended.
What we do is we go into a patient's room that's newly admitted to the hospital, and I do an assessment on that patient using digital equipment, using a computer, and the doctor's actually on the other side of that computer, can see everything that we're doing. Some of the peripherals we use to facilitate the exam are the stethoscope, which is really one of my favorite pieces of equipment. It's Bluetooth, so I hook it up using the computer program, and then the doctor hooks it up on his side, and then he can hear everything that I'm hearing on the patient. Heart sounds, lung sounds, bowel tones, it's amazing. And then of course we have the otoscope that looks in their ears, and ophthalmoscope for your eyes. This has been a very unique opportunity for my nursing career because it's really allowed me to use my assessment skills, and I really enjoy assessing patients.
My experience with working with technology has been excellent. It allows us to reach a patient remotely, anywhere. You could be anywhere assisting a colleague downtown or a different campus or doing something else. It allows us to immediately reach the patient, listen to their concerns, make a diagnosis, and initiate their treatment a lot faster than if we were driving around town to come in to see them. Patients seem to like telehealth. Initially, they're a little skeptical because obviously they're not used to a physician walking into a computer screen. But after I introduce myself and explain what we're doing and the benefits of doing things this way, they seem to be receptive. And in fact, we've had really good outcomes on our post-admission and post-treatment survey. We have demonstrated with telehealth that we equal or actually improve on length of stay as compared to regular bedside evaluations. I think this has to do with the fact that we can make the diagnosis a little earlier, and we can start the treatment right away.
I was about a mile and a half from the ferry, and I lost the vision of my right eye. And it was acute. I mean, it happened within a fraction of a second. And I knew the only chance I had to get vision back was to get to the hospital and get into the stroke program. That was my introduction to actually being in the program. Being a hospital commissioner, I had looked at this program actually probably 2 years prior to that and pushed real hard for us to be part of this program because I thought it was very important for the community to have the availability of this mode of therapy for our general patient population. Never thinking that I would be a participant in the program itself. My personal experience with the telehealth system was very positive. And the things that I didn't realize not being in the system was how rapidly it worked. The most amazing thing was you go to a neurologist's office, you're lucky to see him in 2 hours. I saw him in under 2 minutes, was examined by him, and a therapeutic regimen was determined within 5 or 6 minutes. I mean, it was absolutely amazing.
We've expanded our telestroke programs beyond the Seattle region, expanding outside the walls of Swedish. We have a number of external partners that have utilized the same technology in their communities.
Telehealth is one of those things that's integral, and we think it's a game changer for how you manage healthcare over large organizations. Swedish and Providence came together, and we're collaborating on a whole host of things together. One of them is what we call expert to expert, bringing experts together, a solution to collaborate across state lines, to collaborate across different parts of the country in rural areas, and with institutions that are independent from either Swedish or Providence. There really are not any boundaries. And where the world is going, I want it now. I want it right here. I want it on my phone. I want it if I'm traveling in Africa. I want to be in a clinic in Africa or in South America. It's got to be everywhere. The only way you can do this is through telehealth.
Telehealth has really expanded based on technological advances. The advancements that have occurred in regards to billing and reimbursement, as well as physician licensure and credentialing, have also helped to remove the barriers to telehealth adoption. In the future for telehealth here at Swedish, the opportunities really are endless. We want to be able to have the individual who wants to sit at their desk, sit at their home computer, to be able to log in, schedule that appointment with that provider that they want to interact with that day and time, and be able to readily have access to be able to communicate with their provider. So telehealth can be utilized beyond just the hospital and clinic environment. For example, on a cruise ship, a vacationer may have an acute heart attack and may not know if it's actually a heart attack or if it's just angina, or for that matter, indigestion. Through the use of telehealth, you can utilize the access to specialists such as a cardiologist to be able to quickly in real time determine how to triage that patient. The future of telehealth at Swedish is exciting. The opportunities that we have available to advance telemedicine are endless.